So in this topic, that is module 5, we have to understand what do you mean by potable water. Then we have to understand what is the meaning of the word health, as well as what do we actually mean by water quality. Then there is some discussion on what is fecal bacteria and what are the different types of microorganisms which are transmitted through water. Then how we can purify the water. What are the different methods or techniques used for water purification. Then regarding the sanitary quality of drinking water. These are the various topics which are actually included in this. Okay, so we will start with what is actually a public health. Public health is actually the health of the public. It can be, there is a distinct difference between public health and individual health. Sometimes if you take, for example, in India, if you take the health of different states, the status of Kerala is far better than status of many other states in North India. What is the reason? We have more education and our cleanliness is also far better than most of the other people in India. As a result, we have a better improved public health. Even when corona or other kind of dangerous diseases are coming to Kerala, most of the time our government, our people are able to control it quickly. So if you compare the public health of Kerala, even with the developed countries like UK or USA or Australia, it is far ahead. And if you have any relatives in UK or in Australia or in America, and if you discuss with them how difficult it is to consult a doctor there, if you want to consult a gastroenterologist or a cardiologist in USA or in UK or in Australia, sometimes you have to wait 1 month or 2 months or 3 months. But in our state, if you want to go to a cardiologist, you can book the hospital in the morning and by evening, definitely you will be able to consult that cardiologist or any other super specialty. So that is the advantage of health system in Kerala. But it is not well promoted. Only if you go abroad, we will understand how efficient is our health system, even though it is not widely appreciated or promoted. So health is basically the health of every people, all the people of the state. If some of the people, that normally in a society, 3 different sections of people will be there. Rich people, middle class and poor people. If the health of the poor people is not good, then we cannot say that the state has good public health. Because even if these poor people, they are also human beings. Any disease present, any virus or bacteria affecting them can also sooner or later can affect even the rich people. Bacteria and virus doesn't make any difference between rich people and poor people. So that is why the health of every person in a state is important. So public health is actually a science devoted to preventing the disease. It's a science and art of preventing disease. So as a result, normally the public health professional means not only just doctors and nurses, sometimes sociologists will be there, and sometimes statistician people will be there. So it's a group of several people working together to prevent the disease from spreading in a state. So that is how the public health is. For example, sometimes you are a village officer. You may have to involve a lot in public health prevention. So that sometimes you may be working in a panchayat office or a corporation office or sometimes in a revenue department. Still, you may be involved in a lot of work related with the public health. So this is how the public health is actually protecting and improve the health of the people. There is a fundamental aim is that make every person in the state healthy. That is the fundamental aim of public health. So only if every person in the state is healthy. For example, if you take the average life expectancy of people, what is life expectancy? How old a person, a man or woman, will be living in Kerala? I think it is around 70 or above, between 65 and 70. It is far ahead of the life expectancy in most of the other states in India. And that is because we have a better education and because we have a better health infrastructure. Even though they are not so much high middle class, our health system is very efficient, is very much capable of preventing the disease and also treating the people. And our doctors are also highly skilled in diagnosing the disease. And that also you will be an understanding only if you go to European countries or America. There, doctors may not even diagnose a disease. They will take several weeks or months to even diagnose a disease. But what is the advantage of our doctor is they are consulting some 50 to 100 patients a day. So their practical experience is far ahead of the experience of European or American people. But we never realize that even our political people will go to America or UK for treatment. So we may think that they have a better. Sometimes in certain area they are highly developed, but in most of the cases our health system is very good in compared with many of the other countries. Now, how we can, this is how this work is achieved by promoting healthy lifestyle. So there is one, how we can create or how we can develop public health or improve public health. One way is by promoting healthy lifestyle. There is one, for example, eating good food, eating the right type of food, having good exercise. These are all part of healthy lifestyle. Then researching diseases and injury prevention. Sometimes when Corona came, our government and our health institute are able to produce a good vaccine against it. Sometimes Nipah viruses are coming. Then we have Virology Institute in Alappuzha and also in I think one virology, National Virology Institute in Bhopal also. They will be investigating about the disease and finding some solution for that, how we can identify that virus. So unless we are able to identify the disease, we may not be able to take any precautionary measure. So that is second aid. We have to do lot of research on new disease because bacteria and viruses are very small organisms. They keep changing very fast. They don't need millions of years to undergo an evolutionary change. Maybe within 50 years or 10 years, they can quickly transform or completely transform and develop into a new disease. So that is the advantage of virus or bacteria. They can quickly transform and change completely into a new form of disease. Sometimes what happens is that when we develop a vaccine or a drug against one particular type of vaccine. For example, in case of corona, we are experiencing that. When we develop a vaccination against one form of corona, that coronavirus will undergo some kind of genetic change or mutation and convert to from another different type of corona against which our drug or our vaccine may not be effective. So that is the problem with this virus and bacteria. They quickly change, modify and change and convert into another form. So research is very important. Then how we can able to detect it and preventing and also response to infectious disease. Response to infectious disease is very important because in case of corona, when corona came, most of the government actually they just follow the practice done by the Chinese government, simply closing down all the street and all the institution. But slowly government really realized that that is not a very effective strategy. Because what happens with Australia and New Zealand, they were keeping their border closed for a long time, maybe around 2 years. But when their border was opened, everybody again got infected with corona. So that kind of response may not be intelligent. That not be an efficient way of because in the case of corona, nobody knows how to deal with that. Now government and people are better informed and they have a more practical experience. I don't think any government will be closing down all the states and institution again in future like that. So responding in the right way to disease, that is an important thing, because what happened in the use of corona is that even without dangerous symptoms, many people went to hospital. So hospitals become overpacked. And as a result, what happens is that those who are in need of real care didn't get that care, and they died. So when too much fear spread in the society, the rich people will naturally spend a lot of money, and they will be influencing hospital and doctors, and they will be getting the rooms in hospital. Then what happens? Poor people, or sometimes middle class people, they may not be getting their care when they are in real danger. So that is why many people died in America, because in America, you know that they have a system of health insurance, and people from there used to talk to me that these insurance are different type. They are of different category, very high category and low category. If you are having a low category or low price insurance, what happens is that even if you go to hospital, sometimes hospital will not admit you there, because if there are other people who have taken higher category insurance, they will be given the preference. So that is why many people died in USA, because they didn't get the care, because those people who didn't need the care were occupying hospital. So this kind of approach is this kind of problems are usually increasing the death number in many cases. So having the right approach or right response to infectious disease is also very important. Then public health is concerned with protecting the health of entire population. As I told you earlier, the virus or bacteria doesn't make any difference between rich people and poor people. If your neighbors are poor people and they are having some virus or some viral fever, unless even if you don't take proper care, what happens is that virus will be definitely attacking you, because the virus can spread to air also. So if your neighborhood is not healthy, you are also, even if you are very rich, very influential, you are also at risk. So that is why health of entire population is very important. This population can be as small as a local neighborhood, or a big society, or entire country, or the entire region. For example, in case of corona, we give a term called pandemic. Pan means spread all over the world. So pandemic is a disease that is spreading all over the world. So this is how many of the bacteria and viruses are affecting people. Then public health professional try to prevent problems from happening or recurring through implementation of educational program. For example, right now we have, this is going to be a monsoon season. And in TV, sometimes newspaper, you may be getting some kind of information. Always boil the water, especially during rainy season. What happens during rainy season? Because you know that we are living in a place where there is heavy rainfall, and during heavy rainfall, most of our land become flooded with water, and that water will be entering into our septic tank. And the bacteria present inside the septic tank can mix with the water present in the pond or in the river or in our well. So what happens is that our well water, our pond water, sometimes our drinking water can all get infected with the virus or bacteria present in fecal matter or in the septic tank. So if you don't boil the water, if you don't filter the water properly, we may get infected with this fecal bacteria, and we may have dysentery or other kind of problem. Most of the time fecal bacteria is causing dysentery, diarrhea, etc. Sometimes cholera. Cholera is also spread through, is a waterborne disease, spread through water. So that is why we have to educate the people. Sometimes there are even just education may not be always effective, because everybody says that do not throw waste here and there, but maybe 80% of the people will be following that in our state. but 20%, maybe 10% are not following it. They will be throwing the waste here and there. Sometimes when we go through the road, you can see that lot of waste may be heaped or thrown in some areas of the road. So that area may be a source of spreading, then the area for multiplication of bacteria. So unless the entire population is taking measures to prevent the disease will spread. So I told you earlier, diseases, bacteria or virus never make any difference between rich people and poor people. They will be multiplying where there is an ideal situation for that. So public health professional, they are trying to prevent problems from happening or recurring through implementation of education. Educational program means they are right from our school system. We are advising our children what sort of practices we should follow. For example, wash the hand after going to the toilet. It is an information that you have received right from early age. But there are several people who never follow that. And wash your hands before having a break, having your food. That also will remove a lot of bacteria. Even simple hand washing, not even with the soap, even a simple hand washing can remove a lot of dust from your bag. Your dust will be usually carrying thousands of bacteria in that. So these kind of programs are known as coming under the educational policy and recommending policy and recommending the government about the right policies. For example, when an infectious disease is spreading and only the rich people are getting the care, what happens is that poor people will be dying. And a lot of people will be dying after sometimes that the death rate will be increasing, not even in a manageable situation. So after some time, entire population will be affected. So right policies are important. Then administering services and then research is also important. Because the research is very important, because unless we are actively studying about the new disease or about the diseases present in other parts of the world, now we are living in a global world. If there is some disease in America, maybe within 1 week or 2 weeks it will reach Kerala also, because people are traveling through all over the world. So researching about diseases spreading in other parts of other parts of the world are also important. So this is why we need an active research department to study about our public health. So in contrast to clinical professionals like doctors and nurses who focus primarily on treating individual when after death, so there are two types of clinical professional. Clinical, under the category clinical professional, doctors and nurses are there. When we go to a doctor or nurse, when we have a disease, in order to treat the disease, we are approaching this doctor or a nurse. And these kind of people have specialized knowledge to find out the cause of the disease and give right remedies for that, offer right remedies for that, right preventive methods for that. So these kind of people are known as clinical professional. They came into picture only when we have a disease. Then there is another type of people who are known as a public health disease. The public health workers, because their role is actually protecting the people from a disease. That is, they are active before the disease. The clinical professional will be active only after the development of the disease. So their focus is treating the disease, whereas public health professional will be focusing on preventing the disease. So that is the difference between public health people or public health professionals as well as clinical health professional. A public health also limit health disparity. I was telling about health disparity means inequality, difference between rich people and poor people. That is coming under the health disparity. A large part of public health is promoting healthcare equity, quality and accessibility. So that is where our health system is very good, because even if you have some problem, you can go to the government hospital in Kurvalangad, and most of the time you may not need to pay a large amount unless you have to do some kind of very any operation or other expensive treatment. Most of the time it will be free. So that is the advantage of government system, if there are no government hospital, only private hospitals are there, then poor people may not be able to afford that, and they will develop disease, and that develop will be spreading to rich people after some time. So that health equality or removing the health disparities are very important. Being a public health professional enables you to work around the world, address health problems of the communities as a whole, that influence policies that affect the health of the society. So basically the role of a public health professional is that they are focusing on preventing disease, protecting the disease, protecting the people from having a disease or developing a disease. That is their focus. So for that, we have to do a lot of things. Sometimes we do have conduct active research. We should be able to identify the disease. We should be influencing the government to start enough number of hospital, enough number of research institute. For example, if there is a new disease, what our hospitals are doing, they will be collecting this sample, maybe mostly blood, and sending it to Pune. Pune, there is a virology institute. In Alapi also there is but it is a small scale. But if there is a good virology institute in Kerala, we don't need to send it to Pune. Sending it to Pune and coming back, the result may be taking some 3-4 days. Sometimes if the person is dying before that, then it is a waste. So if we have a hospital, if we have a research institute in Kerala itself, we can get a quick response. We can get a quick, very fast identification, and that will be saving the life of many people. So this is how we are actually, this kind of people are actually involved in protecting the life of the people. Then public health involves application of many different disciplines. Biology is certainly involved. Biology means medicine will be involved. Then anthropology. Anthropology, what is actually anthropology? Study of human beings. Because in Kerala there are different type of people. Some, if you study the genetic basis, genetic differences of people of Kerala, you can see that from Tirunelveli to Kasaragod, there are minor differences between different type of people living in different regions. And if you take our Adivasis or tribal society, their genetic makeup is completely different. Sometimes certain diseases that are affecting us may not affect them. Some diseases that may not affect us will be fastly spreading in tribal society. So this kind of genetic differences are the only anthropologists may be able to tell what are the differences between people. So their role is important. Public policy makers. They are actually the people who are running the government, advising the government how many institutes, how many hospital or primary health centers should be there. Based on the population, they will be influencing the government or advising the government that here in Kottayam district, this much number of primary health centers should be there, and certain that much number of staff should be appointed there. So these are the public policy experts. Then mathematician and statistician. Sometimes when corona comes, they may be telling about R value or something. Different type of statistics of how much time the virus takes to spread. So this kind of data will be there. And they will be supported by a team of statistician or mathematician or computer people. Engineering sections will be there. Then teachers may be involved, educating the people will be there. Then sometimes what happens as a result of some corona or other type of disease, sometimes many members in a family may die. If there are 6 people in a family, 3 are dying, other people will be in extreme shock. So the psychologists will have to offer their service. Then sometimes this other kind of economical support should be given. So public health is a very large, larger branch which involves several people from several disciplines. Then computer science people, sociologists. Sociologists are studying about economical or income disparity, income inequality between different groups of the people. Then business people are involved, because sometimes when when an employed person in a, for example, husband is dying and wife doesn't have a job, what will happen? That family will be suffering unless the wife is getting economical support or a job. That entire family will be suffering and they will be going into a more health crisis that will be affecting the society. So lot of people has to be involved in protecting the health of the people. It is simply not the job of doctors and nurses only, because if we want to, health is actually a weakness in our society. Only if every person is healthy, every person is staying in a good house, clean house, and every person is having clean water, clean food, then there will not be any problem. If some of the people are not getting clean water, good food, then those group of people will be always prone to developing more diseases. And that disease can sooner or later affect other segment of other sections of the people. So this is how public health is actually working. So if we want to protect the health of the people, everybody has to be protected. That is why when we give vaccine, we give it to everyone, not to the rich or not to the middle class. To every person we will be giving those. So unless we protect everyone, there is no actual protection for all the people. So this is an idea regarding how we are actually, what the public health people are actually doing. Then we have some 10 minutes more. So we can here also discuss this topic also. What do public health professionals are doing? Actually, what are the work conducted by this public health professional? For example, they will be monitoring the health status of the community. For example, periodical checkup should be there. Unless if there is some, for example, during rainy season, the primary health centers will be very active. If there is some fever in certain neighborhood, they will be coming and taking report of that, advising doctor and reporting that to the state government. So that state government team will be there. They will be identified. Certain areas in Kottayam district are having high incidence of fever. So what the government will be doing? Government will send more doctors there, more medicines there. So that problem will be immediately solved out. If that is neglected, what happens is that will be spreading to other areas of Kottayam. From Kottayam, it will spread to other districts in Kerala. Then it becomes that virus will be reaching everywhere in the Kerala. So this kind of problem is that monitoring the health status of the community, diagnose and investigate health problem and hazards in the community, then inform, educate, empower people about health issues, particularly underserved and those, for example, very poor people, for example, tribal people, extremely poor people, people living at the lower section of the society who doesn't have any enough income to live to meet their daily needs. Those people may be usually neglecting their health. So those people has to be taken care properly. That is why our government hospitals and primary health centers are very important. Mobilize community partnership to identify and solve health problems. Sometimes poor people may not be having enough money, but if we have some kind of community system where rich people are able to support, then that system will work to reduce the inequality, develop policies and plans that support individual and community health efforts, then enforce laws and regulation. That some police people should be also there, because during Corona we have noticed that when government said that nobody should come out of the house, it is the duty of the police people to implement that. Sometimes 80% of the people or 90% of people will obey the law, but there will be some 10 to 20% of people who may not be obeying it. Then the police people has to come into the picture, link the people or to needed personal health services and ensure provision of health care when otherwise unavailable. For example, during rainy season, especially in tribal area or in hill areas of our state, the health centers are very few. So when they have some kind of problem, immediately they have to be taken to the nearest health center. Otherwise, they will die. Sometimes you may be reading in newspaper or watching in TV that many people in tribal areas of Kerala are dying because of lack of ambulances services. So this kind of problem are there. Then competent doctors should be there and nurses should be there. Evaluate the effectiveness, accessibility, and quality of the personal and professional population. What kind of service these people are giving, whether they are really useful, whether the doctors are showing any kind of partiality. All this should be investigated and monitored properly. Then finally, research into the newer solutions that are needed for protecting the health of the people. So these are the various aspects which are coming under the category of public health. That is why different people from different subjects, different disciplines are involved in that. So then only we can maintain the health of the people and keep our societies safe. So this is an idea regarding what is actually the public health. And in our next class, we will be going to another topic, that is water quality.